Welcome. Please take your seats. Hug your friends. You can see them after lunch. It's going to be an incredible program. Good afternoon and welcome to CADCA's National Leadership Forum Annual Awards Luncheon. I am Mary Elizabeth Elliott. I am CADCA and I am what? The movement. One more time. I am the power of the and you're the power of the movement, of course. Now, we've had a great week. We've had a great week on the CADCA staff. How are you feeling? Has this been a great week for you? Let's hear it. You're part of a global coalition movement, and that's pretty powerful. Today, we celebrate excellence in our award winners, in great leaders, and in each of you. So are you ready to celebrate with me today? All right. It's a tradition that this luncheon starts formally with the presentation of our colors and our national anthem. Our national anthem will be performed by Curis Powell. Please stand for the presentation of the colors by the U.S. Joint Armed Forces Color Guard, and please remain standing until the colors are retired.
Stripes and bright stars through the perilous fight. O'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave?
Colors turn, march.
Thank you all. Please take your seats. You know, a fun fact, our soloist, Curis, sang her first solo in church at the age of 5. Now, I have a 5-year-old, and so that gives me pause. Also, her sister flew in from Detroit and is part of this movement as well, so let's thank her as well. It's all about family. Now, please welcome to the stage Dr. Basha Jordan, Jr., a pastor and founder of Hope Alive Ministry Deliverance Fellowship in Baltimore, Maryland. Dr. Jordan is also a licensed clinician for drugs and alcohol and has been a radio host for more than 2 decades. Please welcome Dr. Jordan with our invocation.
Good afternoon. First of all, giving honor to God, who is due all of the honor and the glory. To General Dean, all dignitaries who are present, to every coalition, every person who's present today. Let us bow our heads and touch someone's hand close to us as a sign of the power of the movement. Oh God, we praise you. We give your name glory and honor because you've been so good. You've been good to us collectively in our work as coalitions. We thank you, oh God, for 24 years of CADCA's devoted service. We praise you and give you honor for the prevention and the reducing of substance abuse throughout our nation and throughout the world. We thank you, dear Heavenly Father, for stalwart leaders from the foot soldiers in the field to the general who is responsible for the entire field. We thank you for all the lives that have been saved from illicit drugs. We just give your name glory for families that have been united and reunited as a direct result of the work of this great body of soldiers who have been empowered by you, called CADCA. We thank you for the children and youth involved in the movement. Now, God, we summons your Holy Spirit to be here and allow your power to flow through the hand which we hold now. We give your name glory and honor in the name of the Most High God of all people gathered. And everybody said, amen.
Thank you, Dr. Jordan. So we're honored to have with us today a number of special guests, sponsors, and partners. Thank you to all of our partners and sponsors. And thank you especially for our federal partners. Without their support, the forum simply would not be possible. We'd like to recognize a few of our federal partners today. As your name is called, please stand and be recognized. From the White House Office of National Drug Control Policy, Gil Kurlikowski, Director. Michael Botticelli, Deputy Director, National Drug Control Policy. Benjamin Tucker, Deputy Director of State and Local and Tribal Affairs, ONDCP. Marilyn Quagliati, Deputy Director of Supply Reduction, and David Mineta, Deputy Director of Demand Reduction. From the U.S. Department of Health and Human Services, please welcome Frances Harding, Director, Center of Substance Abuse Prevention, Substance Abuse and Mental Health Services Administration. Dr. Jack Stein, Director, Office of Science Policy and Communications, National Institute on Drug Abuse. From the United States Department of Justice, please welcome Thomas Harrigan, Deputy Administrator, Drug Enforcement Administration. Tim Jeffries, Policy Advisor, Office of Justice Programs. From the Department of Transportation, please welcome Katie Ballard, Highway Safety Specialist, National Highway and Traffic Safety Administration. From the Corporation for National and Community Service, please welcome Kobe Langley, Senior Advisor for Wounded Warriors, Veterans, and Military Families. From the National Guard Bureau, please welcome Colonel Michael Patterson. Let's thank all of our federal leaders. There's a number of federal staff here. They're essentially important to all of us. Now, last night we got a little starstruck. Did anyone get a little starstruck last night? I know I did. I went up to someone and I said something really silly. I said it was written in the stars that you were here, and I really do mean it. So CADCA is honored to be working with international recording star Mario, who is here with us today. And with Mario is Kevin Sherd, co-founder and president of the Mario Do Right Foundation. Let's recognize them and thank them. We're delighted to welcome Deborah Arice from the International Narcotics and Law Enforcement Office at the U.S. Embassy in Brazil. We've been building coalitions in Brazil for several years, and we're looking forward to expanding our work. So please give a warm CADCA welcome to Ms. Arice. Now, CADCA, you know we model coalition building at the national level, and we couldn't do our work without a strong field. So in the interest of time, we'd like to recognize just a few of our national partners. Scott Melville, President and CEO, Consumer Healthcare Products Association. Pat Taylor, Executive Director, Faces and Voices of Recovery. Cynthia Morena Tui, Executive Director, NADAC, the Association for Addiction Professionals. Sis Winger, President and CEO, National Association for Children of Alcoholics. Mary Louise Embry, Consultant, Policy and Substance Abuse Prevention, National Association of School Nurses. Rob Morrison, Executive Director, National Association of State Alcohol and Drug Abuse Directors. Dr. Kevin Sabet, co-founder and executive director, SAM, Smart Approaches to Marijuana. And Becky Vaughn, CEO, State Association of Addiction Services. Let's hear it for all of our partners. We have outstanding corporate partners here today. Please welcome Mariana Gallo, IMN Solutions. Welcome Dan Cohen, Network for Good. And Nancy Rizzo with Marriott International. There are a number of state leaders here this week, including Fran Fleener, Arkansas State Drug Director, who's also a member of the CADCA board. Welcome, Fran. And Francis Buxton, Interim Senior Deputy Director, Addiction Prevention and Recovery Administration, Washington, D.C. Welcome. Would the members of the CADCA Board of Directors please stand? Please welcome Chairman and CEO General Dean, Vice Chair in Coalition Affairs Geraldine Simpson Jordan, the Honorable Michael Kramer, Willie Mitchell, and Doug Hughes. Would all members of CADCA's Coalition Advisory Committee please stand and be recognized? Help me welcome your ambassadors, coalitions, Diane Casto, Michael Langer, Greg Puckett, Cheryl Gutierrez, Erica Leary, and Cindy Hayford. Thank you for your service to CADCA, and a complete listing of the CADCA board and our Coalition Advisory Committee members can be found in your final program. And now, please enjoy your lunch, and I'll be back with you in a short while to resume our program. Thank you. I'd like to ask Kiris Powell to join us once again for a special musical selection.
I knew how it would feel to be free. I wish I could break all the chains holding me. I wish I could say all the things that I should say. Say them loud, say them clear for the whole world to hear. I could share all the love that's in my heart, remove all the bars that keep us apart. Oh, I wish you could know what it means to be me, and then you'll see
Thank you, Kiris. Over 250 youth leaders are in the house this week for the National Youth Leadership Initiative and the Summit for Youth. You know, the youth always steal the show because they are the movement. Let's welcome young people. Ta-da!
We are the youth of America.
We are leaders.
We are leaders.
We aren't the leaders of tomorrow.
We are the leaders of today.
We are the leaders of today.
We are the leaders of today.
We are change agents.
We are change agents.
I think that a leader should be charismatic and be able to inspire the people that he's trying to lead.
I think a leader is somebody who always gives a positive influence on everybody.
A leader isn't someone who tells you what to do. They help you and the future generation better the world and yourself.
I would describe a leader as someone who actively influences others in a positive way.
I think that I want to do a lot in the world.
Out of all the things I think of myself, I think that I am a go-getter for the most part, because I don't just say or talk about change. I always do it, and I be the change I wish to see in the world.
I'm a strong, confident person.
So I believe I'm a helper. I believe I'm a healer. I plan to save some lives in the present and in the future.
I'm inspired by people who are willing to take a step and just battle through any situation and really find confidence in themselves to just make anything happen, whatever's on their plate.
The thing that inspires me the most is people telling me I can't do things.
I'm inspired by the people that get torn, pushed down, and bullied every day, but they still wake up every morning and it's like, let's do this.
Art and music inspire me.
This generation's youth is not all bad. Like, we're not negative, and we're gonna change the world, and I believe that we can do that. What's really gonna change our schools is us, and we have to come together and do that.
Why do I get involved in the work I do is because I want to change people's perspective on how they see my community.
I've been involved by making commercials and making the community a better place.
So why do I do what I do? Well, I'm deaf, and so I'm already part of a minority group. So I feel that having that experience growing up, I feel like I need to want to help other people. So in that case, I help other people in my community, yes, but also growing up, I realized that I wanted to help others in my community. So that's what I do.
I think one of the key qualities a young leader should have is vision. Vision is very important. Someone who can make good choices under pressure and, who understands that everything that they do, there's a reason for it. This partnership with CADCA is definitely a highlight. I feel like it takes a nation. It takes many ideas that become actions, and then you see results to help people. My vision, partnership with CADCA and Mario Do Right Foundation, is reaching as many young adults as we can across the world. I'm Mario, I am CADCA, and I am the movement. Get with it, baby.
not defined by our age,
gender,
race,
height,
weight, or religion,
but our abilities,
ambitions,
the content of our character.
We are the youth of America. We are CADCA, and we are strong.
After recognizing the negative effects that tobacco use had on my local park, I talked to a city council member, and I petitioned to establish our park as a tobacco-free area.
I'm a change maker.
I used research on the effects of marijuana on the brain to create messaging put up in schools revealing the real harm in marijuana use.
I am an everyday scientist.
I traveled throughout my community to businesses that sold alcohol and advocated for the prevention of underage drinking.
I am an advocate.
I began a county-wide initiative to collect unused prescription drugs by placing boxes in our police departments.
I am an innovator.
I am powerful.
I am an achiever.
I am a leader.
I'm not too young.
We are.
we are,
We are. We are.
We are
We are.
courageous.
We are. Revolution. We are. And we are. The movement.
Woo! Wasn't that exciting? Awesome, I love that. So I know you guys have already rehearsed this plenty of times, but I need your help. I am Jasmine, and I am CADCA, and I am... Yeah, there we go. So every year I have the privilege of being inspired by these young people. They have power, they have tenacity, and they are engaged in the process of the National Youth Leadership Initiative, as well as our Youth Summit workshops. You know, the power of the movement couldn't have been a better theme here. You already saw these young people embody that power, and they are that movement. One person that I would like to thank especially is one of our seasoned NYLI trainers, Melanie Piskai. She started training with us at the age of 15. Now she's 18, a freshman in college. And she has that power, and we're very happy to have her on our team. She wrote me a formal proposal, a written proposal, and said, I want to take on the youth presentation this year. So everything that you've seen today is all, I call her my creative director, has all been planned by Melanie Piskai and her colleague, Ian. I would like to give a shout out to Ian Snoski, who's standing in the back. Thank you. And I'll have Mel come out. Thank you.
Thank you. Hello, my name is Melanie Piskai. I am a National Youth Leadership Initiative trainer, and I am CADCA. And we are... You guys rock. So year after year, every year we have the youth presentation, and this year I had the privilege of being able to head it, which I am so honored for. And every year the youth collaborate to create their contribution to the awards luncheon, but this year the youth have really shown me something. They showed me that the glass really isn't half empty, but it's not half full either. It is 100% full, half with water and half with air, 100% full with the potential for change. And I really think that shows in our presentation. I think we wanted to thank our special guest Mario for letting us share his words with us. We thank him so much for that. I'm so proud of the youth for their hard work, determination, and vision, and I'm sure you all are as well. So please, when you see them, give them a warm thank you and encouragement, because they really are so happy to be here, and so am I, so thank you.
Weren't the youth incredible? They always are. They really are the highlight of this lunch. Not to take away from our keynote speaker, who is our next highlight coming up. So General Dean, please come on stage and help introduce a very special friend of CADCA's.
Good evening. I was so enthralled with the young people that I forgot to get up and be up here on a timely manner, so please forgive me for that. So just a couple of things before I introduce a good friend. Could we once again say thank you to the Armed Forces Joint Color Guard for coming out and blessing us today, number one. I want to thank a longtime friend for coming and giving us an extremely well-timely, well-inclusive prayer, my good friend, Reverend Dr. Barsha Jordan. Thank you very much. And boy, wasn't she wonderful? Curious Power for those two selections, the national anthem, as well as the second one. Thank you very much, Curious. Thank you. And to our young people, and they are our today's leaders. What a wonderful group of young people, and all of the things that you saw and they did that this week while going through their National Youth Leadership Initiative. So they spent evenings and early mornings making that happen for you. So let's applaud them once again. Thank you. I want to thank my dear wife, Deborah, and daughter, Angela, for being with us today. They are so supportive. Thank them for being here. It is an honor for me to introduce and present to some of you a true friend of the coalition field, Gil Kurlikowski, the Director of the Office of National Drug Control Policy. Since 2009, Director Kurlikowski has led ONDCP, coordinating all aspects of federal drug control programs and implementation of the President's National Drug Control Strategy. Gil brought a wealth of knowledge and experience and more than 37 years of law enforcement work to our office, to the Office of National Drug Control Policy. But CADCA members really, truly know him well, because whenever he's had the opportunity to visit us out in the field, he has been at almost all of our national leadership forums, simply a person who cares and is always there to provide a lending hand and a great deal of support. So we know him as really as a gentle, kind man. You know, he's been a police chief for many, many years, and you think of police chiefs as being this tough, rough kind of guy. Well, Gil is the polished, very gentle, but yet forceful leader that always gets it done, and we are very proud of him. Dr. Kurlikowski has gone on record time and time again, stretching that preventing drug use before it starts is an extremely cost-effective, common-sense approach that promotes safe, healthy, and drug-free communities. He, as I said earlier, has visited many of you as he travels this great country. Gil has been a friend to me personally. He literally has had me many times to dine with him at the White House Mess and other places in Washington. Our friendship has grown to be quite significant. And to me, I want to say personally, thank you, Gil, for your guidance, for your leadership, and for your support. It is no doubt that the President and the Vice President made the right selection when they brought him here to head ONDCP. And they also have made, yes, applaud that, please, go ahead, please. And the President has made another great decision as it relates to Gil when he has nominated him to be the Commissioner of the U.S. Customs and Border Protection. Another set of significant responsibilities that he will assume soon after the U.S. Senate finishes his confirmation. So I want to say on behalf of the field, all of you present, many of you out across this great land, what a gentleman, what a leader, what a friend. Please give a warm welcome to Director Gil Kurlikowski, please.
Now, this is great. Hi, everybody. How are you? Good. I'm glad. It's. I think my speech is packed with statistics, but it doesn't sound like after all this that you want to hear a lot of statistics. So, you know, and it was so wonderful when to have General Dean all these years as a friend and as a supporter, but then to be exposed to the CADCA staff, and then to be exposed to all of you over these years. It's been an amazing transformation. I've enjoyed it thoroughly, tremendously, and we're already talking about ways that the 62,000 employees of Customs and Border Protection could actually be better partners and work more cooperatively with CADCA. So I think that'd be great. So let me start out by being a little risky here. You know, when I heard her sing the national anthem, she was just incredible. But you know, I remembered hearing that earlier this week. Are there any Seahawks fans in the? Okay, I'm just checking. I guess I won't go to that other city. Although my 8-year-old grandson lives in Colorado, and he's pretty conflicted as to what to do. So, and then, you know, Art was explaining, and you all were talking about the power of the movement. And I thought, how wonderful, how exciting. But then I wasn't exactly sure about, well, what is the power of the movement? I said, you know, is it a dance movement? But I've seen General Dean dance, and so, you know, I immediately recognized that it wasn't a dance movement. No, the power of the movement is all about you. It really is, and the work that you've done. and this incredible opportunity I've had in 5 years to actually be a part of it and see it up close and to see what you do and what you accomplish. It's been tremendous. So let me make a few remarks. That sustained power of CADCA. It just continues on and on through generations, not only of the young people that are here, but also of the people that are the youth guidance folks, the youth leaders, led by youth, but guided by adults. We could actually use some youth leadership in other places here in Washington, D.C. at times, too. But I think where you're so powerful and where you're so effective, of course, is at the local level. I've seen your hard work to reduce substance use through the local coalitions and to support these critical substance use programs, these prevention initiatives, like our Drug-Free Communities Support Program. Let's give them a shout out too. You have these incredible strategic community-based coalitions, and you've worked to reduce underage drinking, you've worked to reduce tobacco use, and these are at the lowest levels now in the history since monitoring the survey, monitoring the future survey has been done. So it's really very, very impressive work that you have done. And you might hear this a lot in a couple of the things I say, because it really all goes back to you. You know how to collect and analyze the data and the facts. You know how to plan and implement the right mix of strategies to prevent and reduce our drug problem for your particular community. And you're the ones who really make prevention work. Yes. Substance use strains the economic, healthcare, and criminal justice systems in this country mightily. And it limits, and unfortunately and sadly, it also limits the future of some youth. So simply put, well, this is a nation that can't reach its full potential without a drug-free and healthy generation of young people. And although we've made progress in the past 5 years, everyone in this room knows there is still much more to do. More teens now smoke marijuana than cigarettes, and their perception of marijuana's risk is at historic lows. And in spite of the research demonstrating that heavy use starting in adolescence can have long-time negative consequences on cognitive development. And I thought that was so impressive when the young advocate was talking about the research that she did, because that scientific research is out there and it's understandable. And it wouldn't be made that available if it wasn't for the great partnerships we have with SAMHSA and with NIDA, organizations that you know well, and organizations that put into your hands the power of data and the power of science and the power of health to make people think differently about these substances. Well, according to the Monitoring the Future, the percentage of youth in high school who see great risk in using marijuana regularly has dropped dramatically over the past decade. It shows that 39.5% of 12th graders in 2013 viewed regular marijuana use as harmful. That's down from 54.9% in 23. And unfortunately, we know, everyone knows from past experience, when young people think that drugs are less harmful, use goes up. We have a significant drug overdose death problem in our country. So I mentioned the economic pain that comes, but what about all of this pain to families and friends and loved ones that are a result of these real tragedies? And these young people that go into the emergency departments. It's a story that doesn't get told very often. When it does get told, it's often as a result of somebody perhaps famous dying from a drug overdose. But you deal with these things every single day. You work on these problems in your communities every single day. And the statistics, as you know, are somewhat alarming. In 2010, approximately 100 Americans died every day from a drug overdose. 100 deaths every day. As we know, prescription drugs were involved in more than half of the 38,000 overdose deaths. We're also seeing an increase in heroin overdose deaths also, and you've read quite a bit recently in the news reports. These deaths are outnumbering or have outnumbered gunshot wounds, and they've outnumbered motor vehicle crashes. And yet there's not this national outrage, there's not this national energy, there's not this national focus to begin to reduce this. And the fact is, in all of these deaths, all of these young people going into emergency departments, all of this tragedy and all of this expense, we know we can make a difference. This is actually something that we can make progress on. And in many places and in many ways we have made progress, but again, there's much more to do. We're working hard to reduce the misuse of all opioid drugs, including heroin. And the majority of new occasional non-medical users of drugs obtain them from a family member or friend. So once again, in April 26th, will be a National Take Back Day. You all are intimately familiar, and again, one of the young advocates talked about creating those boxes and putting them in police departments. You're the advocates at the local level where the Drug Enforcement Administration teams up with well over 5,000 of their state and local law enforcement partners to collect those drugs, get them cleaned out of those medicine cabinets, and then to make sure that they're disposed of in a proper and safe way. And that makes a huge difference because it also brings attention to the problem. And prevention is the key, and of course prevention is what you're all about. The key to building strong and healthy America lies in the people and the communities, and your work and your success is really more critical than it ever has been. The President's inaugural National Drug Control Strategy, presented in 2010, put a new direction in our efforts to reduce substance use and its consequences in this country. And it's an approach shaped by the recognition that addiction is a disease of the brain. And with any disease, the public health approach that focuses on prevention, use, before it starts, saves both lives and money. Yes. Well, that's why in 2012, the federal government spent $9.2 billion on drug prevention and treatment programs. That's more than twice the amount that they have spent on federal incarceration efforts. So we know that we're headed in the right direction when we can spend money on prevention. And over the past 3 years, the administration has committed more than $27 billion to substance use prevention programs and to support expanding access to treatment for substance use disorders. Prevention is an essential component of the new public health approach, and it's a central theme in the Obama administration strategy. And why? Because everyone in this room knows prevention works. Well, thanks to CADCA and its coalitions for keeping drug use on the radar screen. Well, thanks for speaking up and supporting our federal programs and supporting the necessary and important federal funding that helps to keep our nation's youth safe and drug-free. Good. Well, the administration continues to support through the Drug-Free Communities program, and we know we have so many representatives here and so many committed staff in our office, and our partner that administers that grant, SAMHSA. So we really are excited about this continuation of working with the drug-free communities throughout the country. Effective drug use prevention happens locally. It requires the cooperation of the entire community, and you get everyone involved at the table. I've been to so many community meetings in your neighborhoods and in your places where everyone is there, law enforcement and healthcare providers and faith communities and neighborhood coalitions and schools, educators, etc., and youth. And they're listening to what youth has to say. DFC is one of the best examples of this concept in the country in bringing people together and then making it work. A national evaluation released at this conference last year found that substance use has declined significantly in those DFC-funded communities. So where they exist and where they work, you have less of a problem. Well, we recently announced $19.8 million in new DFC grants to 147 communities. And the awards are in addition to the almost $60 million in DFC continuation grants. These grants provide community coalitions needed support to reduce youth substance use. Well, we look forward to continuing our work with community coalitions in 2014, and your work literally saves lives and it strengthens communities. And you've created communities where young people are encouraged to make good choices, to not use drugs, and as we saw up on this stage, they're so actively involved in their communities. You know, you've created communities where kids are not only recognized, but they are celebrated as role models for these lifestyle choices and the leadership and the mentorship that they provide to other youth. You have responded quickly and effectively to local emerging challenges. For instance, the synthetic drug issues you've been terrific on. You're the eyes and ears at the ground level. Oftentimes we'll hear from a DFC about a particular problem before it's ever really made the news. As I said recently this week on the PBS NewsHour, our kids are bombarded with messages normalizing drug use. What they need now, of course, are anti-drug messages, and you help to provide those. Each one of you serves as an ambassador to young people for healthy, drug-free choices. And in the current media environment, I know you can become frustrated. I think we become a little frustrated too in this current media environment. But your work is more important than ever. And this week you've been surrounded by people who understand that importance and the enormity of the challenges you face. So when you leave here, I know that you will take the energy and enthusiasm of the Forum home with you. You know, just as importantly for our staff who work at this every day, and the staff at the Drug Enforcement Administration, NIDA, SAMHSA, all our other federal partners, they are so inspired by what you do. And when they leave this luncheon, I have heard from so many people over so many years that this is one of the best luncheons that they can ever attend. And if you're in Washington, D.C. as a federal bureaucrat, you attend a lot of lunches. So all of the work that you do together means that you're going to stay in touch, that you're going to make a huge difference. And we thank you and applaud you and appreciate the relationship with CADCA. Thanks.
He's still our ONDCP director, and we're so thankful. Gil Kurlikowski, everyone. And now we're going to get started with our awards presentations. I'm going to just share a little bit about the National Newsmaker Award. This year we're presenting it to Jonetta Rose Barris. Jonetta is an award-winning journalist and best-selling author. And we selected her because over the past decade, Jonetta has also contributed to the Washington Post. And when she writes, she's written several pieces about the impact of increased availability of marijuana in DC, and her very passionate, reasoned approach is what we really want to recognize. And Jonetta was incredibly excited to receive our Newsmaker Award, but couldn't be with us. She was very upset that she couldn't be with us. So I promise Jonetta that General Dean and the communications team will be taking her award to her next week sometime in DC. So I just wanted to recognize her and thank Jonetta Rose Barris. Now the next awards category represents excellence. It's also the way that CADCA can tell the coalition's success story. The God Outcomes Awards is a rigorous process culminating in the selection of the coalitions who are the nation's best in terms of measuring their outcomes. Now, I am issuing a challenge to all the coalitions out there. Got outcomes? Do you have outcomes? Well, show us. Apply for this award next year, and you could be on stage on February 5th, 2015. So get ready. Now, we asked our coalition winners to tell us what makes them so effective, and then we went on location to tell their stories. So we're going to start with taking a look at our first Got Outcomes Award. It's called the Milestone Award, and it's the Tempe Coalition. Take a look.
one of our greatest strengths is actually data. We try very hard to develop good data, and we're getting better as we move along.
We have relationships with the school districts, with the police department, with the juvenile justice courts, where we've kind of made ourselves that clearinghouse for information on things that have to do with young people.
This year, our data subcommittee is really tasked with looking at different sources of information in our community. So these surveys, the focus groups that we've been collecting, and breaking it down and really putting it into a palatable package.
Arizona Youth Survey is a really important piece of data that we need in order to assess youth perceptions and really to find out what youth think and what youth report they're doing.
Another thing that we use very strongly now is a community norms survey. We've just given our third annual survey, and that gives us a good way to measure adult attitudes, not just what the kids think their parents think, but this is actually going to the adults in the community and finding out what they really do think.
Young people will often tell their parents is that everybody's mom or dad or folks let them have alcohol at their home. And when parents hear that again and again, they're going, well, maybe they do. Maybe I'm the odd one out. So we ask the youth through the youth survey, but we want to know what the adults are thinking, and then more importantly, what are the discrepancies between the two? Because that's the area that's ripe for really getting into and making that change happen. But there were still things that we didn't know, like where were kids getting alcohol? That wasn't one of the questions that was asked necessarily. So we decided to do some focus groups, both with youth and with adults, and kind of get their take on what was going on. And the data told us that most kids get it from their home. Either their parents allow them to have it or they just take it. So we thought, all right, well, maybe that home point, that could be at the starting point. And we looked around to see, how other communities were using that. We heard about a social host. And we asked people, would you support something like this? And so we were able to take the data that we'd gotten from the young people that said that they were getting it from home. We were able to take the data that we collected about community support and then give it to the city council and said, look, here's the problem, here's one way to solve it, and here's, people are going to support this. This is going to make you look good. And it passed unanimously.
Officers could always cite an individual for furnishing alcohol. What the coalition did for us was they looked at that and said, give the officers another tool. As opposed to making an arrest or issuing a citation to an adult or a person of legal age for furnishing alcohol or allowing youth to consume alcohol, instead of arresting and sending them through the judicial component, let's give them an opportunity to go through a different branch of the court system.
Both our 21 or Too Young campaign and the social host was both targeted at trying to get adults to not allow their young people to drink and to know it's not okay to do that. And so we have seen that change, and we're just kind of hoping that it continues.
We've come to realize in law enforcement, myself as 10-piece chief, that we cannot do it without our community. And we have to leverage relationships as well, and that's what we've done with the coalition.
Come on up here, Tempe Coalition. Come on up. Congratulations. 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 All right, now I'm gonna announce our next Guide Outcomes Coalition is the Coalition in Focus Award. And this coalition is Coffee County Anti-Drug Coalitions in Manchester, Tennessee. Come up on stage, please. Come on up. You can watch your beautiful video from up here. Come on up.
What I think really helped us with the outcomes that we have achieved is that we have this strong foundation of peoples and partners that are willing to work with us. The staff is there to assist, but it is so community driven, and we've been able to really do this work that the community owns and sees as their own project.
Our permanent prescription drug take-back program really is sustainable. Besides getting data back from our law enforcement, we don't have anything to do with that anymore. They set the policies, they set the procedures, and they're full off and running with that in our 3 law enforcement departments.
All the coalition basically did was got us started in that, and our police department took that over from there. And that's how it's got to be in a coalition. They help us get it started, and then it's up to us to keep it running and to make it work.
With prescription drug safety, our pharmacists and our doctors have taken that on as their own, and they're doing that at each point of contact. One of our pharmacists goes to different groups and talks about it without us asking him to do that. So he's a key sustainability piece to the education.
I think many times we as healthcare providers may not even know that the problem exists until it's brought to our attention. For example, I had given a presentation to a local dental group. We have a controlled substance monitoring database in Tennessee that providers can look up to see where patients have gotten these controlled medicines filled. The dentists weren't as aware of this thing as a tool to help to curb this. In educating these dentists about this, I told them about the database, how to look the patients up in this database to find these potential abusers, and then just to let them know that maybe the quantities you write for could be changed, and even that simple act could decrease some of the diversion right there.
One of the reasons that the coalition hired me was to create the lead group, which is our high school arm of the coalition. And we meet with them at least once a month. When the coalition does something, a drug take back or something like that, we invite them to come along. When we do initiatives in schools and campaigns, we invite them to design the material. Then we run it through does it fit? Does it work with what we're trying to get done? And that's so they drive those ideas. They drive most of those things.
One of the things that I do working with the school system is as a connector between the coalition and the schools, I've got access to data. Working with central office, I've got access to personnel that can approve some things fairly quickly. So that's been a good position for me to be in, helping the coalition over the years.
I think that the coalition and the staff have been successful because they found not just people from each sector, they found the right person from that sector. They've allowed an environment of discussion that permits people to voice opinions and find a way to move forward with everybody's support.
And it really took getting to know what we call dating our individual partners and spending time with them. The odds are staff aren't always going to be there, but if you have these partners at the table, they're going to sustain these projects. And when they understand it and they own it, then you have a lifelong organization.
Congratulations. Wonderful. Lastly, let's recognize our Coalition of the Year, Matt Force, Prescott Valley, Arizona. Come on down. We're going to take a look at their story also through video.
I think the
that the greatest strength of MatForce is our ability to change policies. And that's something that's very difficult. If you look at the 7 strategies for change, the first one, providing information, that's fairly simple, and we've done an awesome job providing information. But we realized early on that to have that effect that we needed to have on reducing substance abuse, we needed to look at policy change.
We were dealing with legalized substances that were really having a tremendous negative impact on our communities. We had to get the doctors on board because they were prescribing. They were becoming the source of the supply. We were fortunate enough to come across a doctor by the name of CADCA, who we call Dr. C. Talk about a guy with a lot of energy. I mean, and that access into not only the medical world, but he also used to be a pharmacist. And so he was able to give us a lot of education, a lot of strategies in terms of how to deal with the healthcare system.
So with people from MatForce and Sheila Polk, the county attorney, lady from the Arizona Justice Commission, Shana Malone, we went in a group, as a group, to visit the various district managers for corporations such as Walmart, Fry's, Safeway, etc., and to discuss the problem with them and raise awareness of it. So we next went to the Arizona Pharmacy Association and met a very nice young lady who's in charge of that by the name of Kelly Ridgway. What she did was to organize a conference down in Phoenix involving all of the major corporations and some of the community pharmacists as well as members of MatForce. Now, it's gone full circle to the point where some of the pharmacists now have a checklist of things they have to do before they fill a controlled substance prescription.
It was kind of a thing of beauty to see how quickly our coalition said, yes, the business community, we're going to take on these strategies. Law enforcement, yes, we'll tackle these strategies. The hospitals, yes, we'll tackle these strategies.
We also put together an unruly gathering ordinance.
There's some enhanced enforcement efforts that we can take when there's a location, a residence, a house or apartment or something where there are habitually parties where underage drinking occurs. That was definitely a team effort.
One of the key things with changing policies is you have to have the right people at the table. And you have to have people that aren't afraid to go knock on doors. And you have people that aren't afraid to maybe get a little bit of pushback.
Prior to 2006, we were a county filled with well-meaning, hardworking individuals, but we didn't really have these relationships and connections across agency lines. And we certainly, we weren't leaders of agencies that typically looked to citizens and residents at a grassroots level to be part of solutions. Today, MatForce has so much credibility and there is so much trust that it is very easy for us to heighten awareness, to implement program changes really across the board with any agency that we want to work with.
Congratulations to all of our God Outcomes winners. Now let's welcome CADCA's public policy consultant, Sue Thaw, on stage to help General Dean present these next awards. Now, a lot of folks have been saying that Sue is the best advocate for prevention, and you know it's true. But we can't do it without you, and so we're all advocates for prevention. And this year we're recognizing 3 people who took their work, as they say, to the next level with exceptional results. Our first awardee is Bill Genties Project Coordinator for Lake County Underage Drinking and Drug Prevention Task Force. Please join us, Bill. Bill was instrumental on the task force, which focuses on underage drinking, prescription drug abuse, and marijuana issues. And he helped lead the passage of the aggressive statewide social host law that became law in 2013. Bill's a former two-term mayor of Round Lake, Illinois. Any folks from Illinois out there? A community of 18,000 people. He's been working hard to secure Senate champions for the Sober Truth on Preventing Underage Drinking Act reauthorization. Congratulations, Bill. Next up, we welcome Karen Murray, Butler County Coalition for Healthy, Safe, and Drug-Free Communities. Karen coordinated Miami University's involvement in the Ohio College President's Initiative to reduce binge drinking and help to establish the Coalition for a Healthy Community, Oxford area. She has advocated for the sustainability of the Drug-Free Community Support Program with Ohio leaders such as Congressman John Boehner and Senators Rob Portman and Sherrod Brown. She worked to install 7 permanent medication disposal boxes and 7 successful countywide medication drop-off days, diverting 7,000 pounds of unneeded or expired medications. Congratulations. Next, we welcome to the stage and recognize Deborah Williams, Anchorage Youth Development Coalition. Welcome, Deborah. Through her past experiences as a presidential appointee in the Clinton administration, a practicing attorney, and the CEO of the Alaska Lung Association, and a member of many boards and commissions, Deborah has focused for years on public policy, achieving many legislative and regulatory victories benefiting public health. Recently, Deborah worked with the Alaska U.S. Senate delegation, her coalition, and CADCA on important prevention funding and reauthorization issues. Thank you so much for your advocacy. And now I'd like to ask Scott Melville, president of CHPA, to help General Dean with our next award. Scott? Since 2006, CADCA has been working with CHPA to educate communities about cough medicine abuse. Together, we created the Dose of Prevention Award, and Scott has been an incredible partner. This year's winner is Substance Abuse Free Environment, SAFE, from Chesterfield, Virginia. Come on up on the stage, folks. We were able to tell their story for video. Let's take a look. Welcome, congratulations.
SAFE stands for Substance Abuse Free Environment, which serves the entire county of Chesterfield, Virginia. We have about 320,000 people. It's a large suburban county south of the city of Richmond. In 2010, our survey data was starting to show that we were having a significant problem with prescription drug abuse among the young people in Chesterfield County. However, the survey didn't contain a question about cough medicine abuse. So in 2012, we added a question to our survey, and then we were really shocked to learn that this was almost 3 times the national average for past 30-day use. In addressing cough medicine abuse, of course, your primary audience is your parents and other adults. One of the issues is that parents are not aware of this as a problem at all. At our middle and high school orientations, which are very well attended by parents, we provided a brochure on cough medicine abuse along with some information about the importance of locking up prescription drug medications to about 8,000 parents. But we decided to take a little more non-traditional approach in trying to reach parents. And actually, this came kind of serendipitously in that someone brought back a receipt from their pharmacy, and it read, "Preventing teen cough medicine abuse. You must be 18 years of age or older to purchase medicine that contains DXM." We wondered, how easy is it actually to go to stores and buy the over-the-counter cough medications? And so we got together a group of about 5 teens and sent them out to major pharmacy chains, grocery stores, big box retailers, and also a few convenience stores. We found that out of the 22 stores that they visited, a little more than half of the stores they were able to actually purchase the medications. We followed this up by contacting the regional managers of these stores and congratulating the ones that had policies for taking a voluntary stand in helping to protect our young people.
Well, by chance you have your ID with you today?
But also noting that the policy wasn't always consistently enforced and encouraging them to talk to store managers and make sure that clerks were following the policy so that they were not selling to anyone who would come in under 18.
It's coming up not for sale.
May I ask why?
Because you're not 18 years of age. It's store policy, you have to be 18.
We were fortunate by doing this project to get some good media coverage. Our real coup was an article in the Chesterfield Monthly. This was able to reach a lot of parents in the community in a better way than anything else that we could have done. And of course, everything is pointed back to our website where you can find more information about cough medicine abuse, where to get help, and what to do if you think there's a problem. We developed a series of 4 summits where we divided into work groups to focus on different aspects of the issue, including community education, healthcare professional education, and proper disposal of medications.
In one of our very early forums, we realized the need to educate not only the lay public, but also our clinical providers and our prescribers.
The healthcare provider education work group actually put together 2 major trainings for healthcare providers.
We brought speakers well-versed in best practices to speak about common protocols they deploy before providing medications that could be potentially addictive.
Our community education work group decided to utilize the Medical Reserve Corps, our volunteer branch of the health department, to go out in their official shirts to physician's office to help get information out to the general community.
We're also holding, again, not only summits for the professionals, but we've had community summits. We paired this with messages at the same time through a media campaign that was funded by the Virginia Department of Health. So while we're going out into the community talking about locking up your medications and drug takebacks and inviting specific providers to these summits, our community, including the providers, were also hearing these messages through the TV, through radios, through ads. Hearing the message from multiple venues was really successful.
We really realized that we had a problem, and the way that as a coalition you solve problems is you bring people together who all have their own take on the problem, and you get them to start working together, thinking about what can we do to change things.
I knew that SAFE was holding their medication abuse summit, so I volunteered to go to that and be the representative from the Attorney General's office. We've been able to take what they've done on a local level, and we have the resources to take it to the state level, and that's what I'm trying to do with this statewide mentoring program, with the statewide lock boxes.
I got involved in the project because growing up, being exposed to certain things which I maybe shouldn't have been exposed to, I was able to turn my life around, and I have truly been trying to use my message, my life story, to impact and make a difference in the lives of those around me.
Congratulations to SAFE, and thank you to CHBA for being a tremendous partner. CHBA also gave SAFE a little something to help them back in their coalition, a $1,500 cash award, so congratulations. Now the next award is for CADCA's Outstanding State Member, and the award goes to Ohio Department of Mental Health and Addiction Services. Ohio, anyone out there from Ohio? Let's hear you. Such a strong state. For nearly, Ohio's been a member of CADCA pretty much as long as we've had members. Not only have they been a longtime CADCA member, but they've collaborated with the Drug Free Action Alliance to grow the number of dues-paying CADCA members and further assist the nearly 100 community coalitions in the state. Last year, CADCA staff just kept getting invited back to Ohio. It was like amazing. We felt the love. We were able to support several key events throughout the state. Ohio also provided funds to the coalition for a drug-free Greater Cincinnati to implement a coalition academy. Congratulations. Wonderful, congratulations. Our next award is for the Outstanding National Guard State Civil Op Program. The National Guard is such a tremendous partner to all of you. This year, CADCA is recognizing the New York National Guard Civil Operations Program. Congratulations, New York. Let's hear it for New York. Through a partnership between the New York Office of Alcoholism and Substance Abuse, National Guard Civil Operations Specialists work alongside and in coordination with the Regional Prevention Resource Center staff to identify community coalitions that need technical assistance and training. They've hosted 3-week-long CADCA academies. Each coalition that participated in the academy was paired with a PRC community development specialist and a National Guardsman. They worked together to provide coaching and mentoring to the coalition during the academy and beyond. Congratulations to New York. While they're getting this situated, I will also share that New York is also being recognized by the National Guard Bureau for their excellence. And joining us on stage is to present the Minuteman Award is Colonel Patterson from the Counter Drug Division of the National Guard. So welcome to him. So we'll do yours right after this. Yes, I did. Yeah. These guys are going to have to get some more luggage, take home all their awards. Congratulations to the National Guard. Let's hear it for the National Guard. Those of you who go to the National Coalition Academy, could you have the National Coalition Academy without the National Guard? No, we love them, great partners. They help power the movement. Now, our last award of the day is always a special one, and that's because we get to hear another positive youth voice. CADCA's Outstanding Youth of the Year is Deja Seth. Now we get to hear from Deja, so let's hear from Deja.
Good afternoon, ladies and gentlemen. I'd first like to thank God, who is my source and inspiration in all that I do. All the glory and the praise goes to him. I'd like to thank CADCA for choosing me to be the recipient of the National Outstanding Youth Leader Award. This is an honor. As well, I'd like to thank the Delaware Prevention Coalition, who I have been involved with for 7 years now. Thank you, DPC, for all your continuous support. DPC was knowledgeable enough to introduce the National Youth Leadership Initiative to Delaware. NYLI taught myself and my peers about strategic prevention framework, leadership, and the meaning of grassroots community engagement. In addition, I'd like to thank Mr. Brandon Farrows for your leadership of the Middletown Youth Prevention Frontliners. You allowed us to have a voice. And last but not least, I'd like to thank my parents, Rhaenyra Cooper Seth and Terry Seth, for your love and support in all of my endeavors that I may pursue. Thank you again, CADCA, for this esteemed honor. I am truly grateful. I am Deja Seth, I am CADCA, and I am the movement.
Let's hear it for Deja. Woo. So, we have a few more things to do. I want to thank you guys so much for your attention, your kindness, your positive energy, your forgiveness if I flubbed anything up here. I have one last responsibility, which is to help recognize prize winners. Who doesn't love prizes, right? As an incentive to join the Gaylord Hotel block, we have randomly selected people to win prizes from this group. We have 3 hotel gift certificates, each worth $215. to use here at the Gaylord or at any Marriott hotel. Nice thing about them, they never expire. We love that. And if I call your name, you can claim your prize at the registration table, and you can ask for Christy. Also, we are, of course, giving away free registration to the 2014 Mid-Year in sunny Orlando this July. And the 2015, can you believe it's going to be 2015? Sounds so weird. 2015 Forum next February here in sunny DC. Now, I want to assure you we used a high-tech computer program to find your names. We did not play favorites, okay? So here are our winners. Let me get my notes. I need a drum roll for this. You guys are good. You are so good. So winner of a Marriott gift card for $215 is Michael Reganelli. Michael, are you here? Yay, let's hear it from Michael. Another big Marriott winner in the house is Arvis Dosella. Arvis. We picked you because you have a really cool name. Our last Marriott gift card winner is Maggie Anderson. Congratulations, Maggie. Now, who's coming with us to the Mid-Year this year in sunny Orlando? Why, it's none other than Karen Whittico. Congratulations, Karen. I'm feeling like a game show host. I'm sorry, that was delivery. And last, we will welcome this gentleman next year around this time. Michael Harris, you will be coming free registration to the Forum next year. Congratulations to all of our winners. It's really been a pleasure to serve as your MC today. The CADCA Forum is my favorite time of the year. It's exhausting, it's sometimes life-changing, it's always inspiring. I love our members. And in a sense, I want to tell you guys that you power my movement every day to get out of bed and get to work. And I really thank you. And now I'd like to close by turning it over to General Dean, our wonderful leader, for his closing remarks. General Dean.
Would you please help me thank our wonderful MC for the great job she did this year. Mel, thank you. It's been a great week. But before I forget, right up front, we still have some workshops after this event is over, and I'm going to be very short. So please, those facilitators and instructors are waiting to see your smiling faces. And then for those of you that are interested in the Drug-Free Community Grant Program, there will be an applicant workshop tomorrow here for you as well. And I know you've known that our weekend is planned accordingly. So please avail yourself of those opportunities. First, let me thank everyone for being here, not just today, but for all week. We know how challenging it is and how expensive it is, although our partners, both private and federal, help us to keep your costs as low as possible. But I want to thank you for being here, and I want to applaud you on behalf of myself and all of CADCA. Thank you very much. And many thanks to our partners. You see them on the screen. They're in your book for their great support as well. We could not do it without them. What a great leader we've had at ONDCP, Gil Kurlikowski. Just a wonderful, great leader. And let's say thanks to Gil again. As I said earlier, our federal and private partners in the room today, we thank you. We thank you for your support, not just today, but for all year long. Clearly, our friends at Substance Abuse and Mental Health Services Administration, particularly the Center for Substance Abuse Prevention, without you, this event would not take place, as well as our mid-year, and we thank you for that, friend. Thank you very much. We had some wonderful exhibitors downstairs as well. I hope you had an opportunity to visit with them, but their work in support of us is critical. and we thank our exhibitors, and we invite them to join us next year as well. I want to give a shout out to the Gaylord for all of the great support that all of your stars have given us all week long. You are such a professional organization, and many, many thanks to all of the stars that represent Gaylord. Thank you very much. We had great support from our vendors this week as well, and I want to single out BAV. BAV has been our long-term AV team that's provided support not just in here but throughout the conference. And to BAV, thank you very much for your support. My staff, as you can imagine, the moment that our mid-year is over, normally the end of July, they turn full force to putting together the National Leadership Conference while also putting on our annual Drug-Free Kids campaign dinner. So I want to say to the entire staff, thank you for your dedicated professional work. And I want to give a shout out to our coach, and that is our Vice President for Meeting and Special Events, Gwen Breckenridge, and her team. Thank you very much. Thank you. I hope you will return to your communities energized, renewed, and empowered to go back and continue to manage and support the changes needed in your communities. We know it is important to do that. We've tried to do a few things different this year. I hope you have enjoyed them with the power of the movement, plenary that we had, the exciting state meetings, and many other opportunities that have been somewhat different. It's all about causing you to feel the power, to be a part of the power, and to take it back into your communities. Join us as we continue this theme at the mid-year. You heard that from Mary Elizabeth in Orlando, Florida, coming up in July. We look forward to that. And then we will be back here, obviously, next February as well. One item I would ask you to pay attention to when you get back to your communities is our conference evaluations. We send them out to you by electronic means. Many of you do fill them out, and I ask you to continue to do that because they help guide us and give us good constructive information so we can continue to improve and make sure that Form 25 is equally as good as Form 24 has been, and we look forward to doing that. I wish all of you Godspeed as you travel back into your communities. Realize, as Director Kurlikowski has said, and our young people, that we can make a difference. We are making a difference, and we will continue to do that. It is critical that we do. I tell my team all the time that as our citizens make these unfortunate decisions, our work is more critical, not less critical. Let's stay focused. Let's stay energized. Let me conclude by saying, I am CADCA, you are CADCA, and together we are the movement. God bless you. Take care.